Doctor strike may be prolonged in Lagos than other states, and NAD. The Association of Resident Doctors Lagos State University Teaching Hospital chapter has said that its members might not resume work even if the ongoing nationwide doctor strike ends. The president of the chapter, Dr. Aziz Ojekunle, disclosed this on Friday at a news conference in Lagos. Ojekunle said that lawsuit NAD strike might linger if Lagos state government will not expedite actions to meet its demand. He, however, said that the association was willing to resume negotiations to ensure the resolution of the industrial disharmony. According to him, there is misinformation that the association joined the nationwide strike in solidarity with its national body. We hereby set the record straight to citizens of Lagos that there are several local issues affecting the Lagos State chapter of NAD and the healthcare delivery system. The lawsuit NAD, in a show of unparalleled patriotism, has been engaging the government since past years with several correspondence and a meeting. However, it has been a series of unfulfilled promises after 4 months a grace period since the suspension of the strike. Following perceived insensitivity from the government despite all diplomatic measures explored, we were left with no other option than an unavoidable industrial action. Today marks the 33rd day of the strike with no end in sight at the Lagos state and national level, he said. He said that there had been full compliance with the strike directives in the hospitals, which he said had affected healthcare delivery. Ojekunle regretted the impact of the strike on patients, appealing for their understanding. On the way forward, Ojekunle urged the government to withdraw the circular removing house officers from the state scheme of services. Ojekunle also called for the immediate release of the medical residency training funds as approved by the state government. He added that there should be a template for regular recruitment of resident doctors and medical officers to consolidate existing exit replacement. The president also called for the recommencement of the residential quarters project for resident doctors in Lagos, saying that the project had been stalled for over a decade. Ojekunle pledged the association's commitment to supporting the government to improve the health of Lagos citizens through discharge of its duty and constructive engagement. The National Association of Resident Doctors embarked on a nationwide indefinite strike on August 2nd. NAD said that the strike was to protest poor working environment in public hospitals, irregular payment of doctor's salary and hazard allowance of $5,000, which was reviewed last in 1991. The strike was also to demand immediate withdrawal of a circular removing house officers from the scheme of service. The Nigerian Medical Association on August 31st issued a 21-day notice to the federal government to resolve all issues affecting its members. NMA said that it will summon an emergency delegate meeting to review progress made on the implementation of agreement after the expiration of the notice. The NMA said that it supported all its affiliates in their effort to improve healthcare delivery in Nigeria and the welfare of their members. This is the news for today. A doctor strike may be prolonged in Lagos than other states. NAD said this is the 33rd day and the 33rd day and the NADs are still on strike. You can imagine by in a time like this where we are going through the second wave of COVID-19. Where the health workers are in the forefront fighting this issue in most developed or in the Western world. Nigerian doctors are on strike. Nigerian resident doctors are on strike. And these are doctors in the public hospitals in Nigeria. These are doctors in the government hospitals in Nigeria who will attend to the patients. Now they are now leaving all the nurses and all these youth corpers to be overwhelmed with duties in the hospital. People that are not professionally trained to handle issues like this. So you can see that Nigerian government is not trying when it comes to protecting lives and properties. And these people have been complaining of hazard allowance of only 5,000 naira. You can imagine the government have been owing doctors a hazard allowance of 5,000 naira. They put their life on the line, risking everything to save patients, to save the lives of others. And the government cannot even pay them 5,000 naira for hazard allowance. You can imagine that. And I brought you a news recently whereby Saudi Arabia government employed 500 of our Nigerian doctors and they received their salary recently and the doctors were so happy saying that their salary is even 10 times more than what they are collecting here in Nigeria. You can imagine. If we continue like this, we will lose our doctors. We will not only lose our doctors, we will lose all the smart brains in Nigeria. Because we can see that we have so much potentials and smart people in Nigeria. These are doctors that are qualified to work and help the Nigerian government move further. But because of the weakness and the lack or the failure of our government, we find that other countries are now hiring our doctors. So I think it's high time the federal government attend to the NAD and call back these resident doctors so that this strike can end and our hospitals can grow. Because this is affecting the medical health sector, is affecting patients in the hospital, is affecting every single person. Knowing fully well that we are still fighting the COVID-19 in Nigeria. Well, what are your thoughts and opinion concerning this? And the NMA has given the government a 21-day ultimatum that if the government doesn't meet their need, they are also going on strike. You can imagine the NAD are on strike now. The NMA are planning on going on strike. And they are saying all their affiliates will also join them in this strike. Well, what are your thoughts and opinions concerning this? Do you think the federal government is doing what it needs to be done, or do you think the federal government is so relaxed and not fulfilling their promises, knowing fully well that the government officials and our politicians, when they fall ill, they travel outside, they enter planes and fly abroad and go for their medical checkup abroad without being concerned about our healthcare in Nigeria? This is why they pay less or no attention to the medical facilities in our country, because they have the resources, they have the money to go and treat themselves outside, forgetting that the poor masses cannot do so. The poor masses have to rely on the public, the general hospitals in Nigeria. Well, drop your comment in the comment section below. Let us know your thoughts, let us know your opinion, let us know what you think about all the strike happening in Nigeria. Let us know what you think about the insecurity and all the insurgency happening in Nigeria. Well, this is Gleanful, and if you are coming here for the first time, I want to say you're welcome to this platform. This is a channel where you get updated with what's happening in Nigeria and in the world a lot. So if you want to get updated with daily and global news, all you have to do is subscribe to this channel. Just hit that subscribe button and hit the bell by the side, so whenever we drop our daily content, you will be the first to get notified. So just keep watching Gleanful, and God bless you. Do have a wonderful weekend.